Rajasthan, India's largest state, extending from the outskirts of Delhi to the Pakistan border. It's famously home to royal forts, small desert villages, and congested cities. And evident here is the sheer scale and diversity that India must conquer to complete its huge COVID vaccination drive. We've driven to Barmer, the last major outpost before we hit the heavily protected border with Pakistan. Bhika Ram's got decades of experience distributing vaccines throughout this vast area.
There's a lot of pressure and I'm the only driver. I start work early in the morning and finish by 11 at night. It's tiring.
His day starts at this modest but heavily secured building. It's where the local government stores thousands of doses of vaccines before they're trucked off to the many hospitals and healthcare clinics that dot the region.
I got a dose on the first day of vaccination and a second dose 28 days later. I have a strong feeling that I'm now immune.
More than 30,000 people have received the jab in the district of Barmer. There's a long way to go. Local authorities want to vaccinate over 500,000 people.
My longest drive to deliver the vaccines is 350 kilometers. It's very difficult work. Sometimes my van gets stuck in the sand, but I always manage to deliver the vaccines.
India is the world's second most populous country, home to 1.3 billion people. The government doesn't yet have plans to vaccinate them all. Rather, it's focusing on 300 million people deemed most at risk. Healthcare workers, police, soldiers, teachers and sanitation workers were the first in line. The next phase that targets people over 60 or those with health problems is about to begin.
We are very busy and there's excitement among the people for the vaccine. Healthcare workers are coming forward in large numbers. The vaccines are safe.
India's official daily infection rate has plummeted. Last September, it was recording close to 100,000 new cases a day. It's dropped to almost a tenth of that. But a recent uptick is concerning doctors.
We have this small, tiny window of opportunity. We need to get going fast now.
Walking around the streets of Delhi, you can see a sense of urgency is gone. The number of people wearing masks, which has always been patchy, is declining. Business is bustling again. So what's allowed this to happen? Well, one recent study shows more than half the residents of Delhi have developed COVID antibodies, meaning half the population has previously been infected. That suggests the rate of infection is much higher than the official data. The state's health minister says Delhi is inching towards herd immunity.
As pandemics by their very nature and definition are diseases of the crowd, I think the number of infections, the sero surveys show that it has infected so many people that it is finding itself difficult to transmit itself.
So we are coming to a normal ward now. This is the normal ward where all non-COVID patients are being admitted here.
Nowhere is that more obvious than here at Nayak Hospital. For months, this was the nation's biggest COVID hospital. All of its 2,500 beds were dedicated to coronavirus patients.
This whole building was a COVID dedicated ICU kind of thing. All the patients were COVID here. This was full and there was a time when a lot of deaths were occurring here. I also suffered from COVID. These people have also suffered. All these residents have suffered from COVID.
Now it's mostly back to normal duties, with only 300 COVID beds and around 30 patients. Are you confident now the worst is over, that things will be much easier for Delhi?
We have to keep our finger crossed.
While the falling numbers are good news, doctors worry that many people are reluctant to take the vaccine.
My parents etc. were worried about it. They said that they're not ready to take the risk of getting any adverse reactions.
India is using 2 locally manufactured vaccines. The first is the Oxford AstraZeneca vaccine. Dosage and time between jabs have been a source of confusion. Data on Indian trials is yet to be published. While the other, a locally developed vaccine called Covaxin, is being deployed even though the trials haven't been completed.
Things are a little better. This is our ICU.
Dr. Sumit Ray runs a not-for-profit hospital.
So we have almost all non-COVID patients now.
He says approving Covaxin early was a mistake.
If there was transparency, people would have been much happier to take the vaccine, much safer. But because once the hesitancy starts, to stop that is much more difficult.
Regardless of how close to herd immunity Delhi or other parts of the country may be, India's huge population means there's plenty of capacity for further outbreaks. New strains from overseas have also heightened concerns.
I mean, we expect that there would be smaller surges again at some point of time, sooner or later, but probably not to the scale that we faced.
If there's even a single slip and the variants start, then heaven help us.
The government's vowed to ramp up daily jabs to 5 million, something many say can't come soon enough. James Oaten, ABC News, Delhi.